Hey everyone, thanks for listening to the FU Cancer podcast. Today we're taking on a topic that affects countless cancer survivors, but is still surrounded by stigma, silence, and a lot of confusion. We're joined by Dr. Amanda Olson, a pelvic health physical therapist, entrepreneur, author, global educator, and passionate advocate for empowering both men and women through better pelvic health care. Dr. Olson has spent her career breaking down barriers, supporting patients living with pelvic pain, incontinence, pelvic organ prolapse, endometriosis, MRKH, and the often overlooked pelvic health complications that follow cancer treatment. She is the president of Intimate Rose, an award-winning pelvic health device company known for its innovative tools that support pain reduction, improve function, and restore quality of life. Dr. Olson holds multiple patents, has authored 6 peer-reviewed journal articles and the book Restoring the Pelvic Floor for Women, and is the recipient of the prestigious Elizabeth Noble Award, the highest honor in pelvic health. Her work spans the globe, educating clinicians and transforming patient care through practical tools, evidence-based rehabilitation, and a commitment to reaching underserved communities. Today, she's here to help us understand what every cancer survivor should know about the pelvic floor, how treatment affects it, and what can be done to heal. Thanks for listening to the FU Cancer podcast. My name is Christina Rollins. I'm a dietitian, mom, and wife to a pretty awesome cancer survivor. We said FU to cancer nearly 25 years ago and are still going strong. I'm excited to share the FU Cancer movement, where we are a community of survivors, fighters, caregivers, and advocates, connecting our shared experiences, passion, and determination to live a holistic and well-balanced life. Stay tuned, because we've got a lot to talk about. Dr. Olson, thank you so much for joining us today on the FU Cancer podcast.
Thank you so much for having me.
So what exactly is the pelvic floor, and how does it impact bowel, bladder, and sexual health? And my understanding is we're talking about both men and women. So to kind of tell us a little bit about that to get started.
Absolutely. The pelvic floor muscles are a group of muscles at the base of the pelvis. So they start at the pubic bone and then they swing out wide to the bones that we sit on, and then they come back towards our tailbone. And all people have a pelvic floor, men, women, all the different people. And these are muscles that are just like every other muscles that we have, just like the muscles in our arms and in our legs. They can be strong, they can be weak, they can be tight, they can be coordinated. And what we want is for those muscles to be well coordinated, strong, and mobile. And they do support all of those organs in our pelvic bowl. So that includes the bladder, the vagina, and the uterus in people that have them, and then the bowel on the back side. So these muscles turn on when we're moving around so that we don't leak urine, and they also relax and drop when we need to do something like have a bowel movement, or when we need to place a tampon, or when we have intercourse.
And what are some of the impacts to a person's pelvic floor when they go through radiation therapy, surgery, or even chemotherapy?
Absolutely. All of those different components of cancer treatment can have different effects. So for example, chemotherapy can cause vaginal dryness. It can cause changes to the flexibility of the muscles around the urethra. And that can result in a feeling of dryness or in pain when trying to have a speculum exam or when trying to have penetrative intercourse. In both genders, it can sometimes cause tightening around the anus. I'm sorry. Going to radiation now. When radiation happens to the pelvis, it can also cause that thinning of the tissue and tightening around the vaginal opening or around the anus. That can make it difficult to have that speculum exam or to have penetrative intercourse. And then on the bowel side, it can make it difficult to control the pelvic floor muscles. So people might experience lots of diarrhea. They may also experience pain or difficulty with bowel movements. And then surgery can leave the effects of scar tissue, which leaves the tissue less mobile as well. The good news is that pelvic therapy can help to address mobility of that tissue. We certainly can't take scar tissue and make it like it was before, but we can help to make sure that it's not as painful. So we do what's called desensitization training. And then we also do really gentle techniques to help it be more flexible so that it does resemble the tissue that it was prior to the surgery or the radiation.
I think something, unfortunately, that a lot of us become really good at is kind of explaining away some of our symptoms, right? So either I'm getting older or I am going through treatment, and this is just a thing that I need to live with now. So, what symptoms should patients look out for that should be a trigger that, hey, something's not right? I need to talk to my physician?
Absolutely. So any pain that they might be experiencing with speculum exam through the vagina or penetrative intercourse, also for men, any issues with erectile functioning, or issues that they might be experiencing with intimacy as well. And then also any urinary incontinence. So if you're coughing and sneezing or laughing and you're leaking urine, that is something that you want to report, and that is something that in pelvic health physical therapy we can help address. And then bowel changes. So whether it's diarrhea or constipation, we can help retrain the muscles so that you can maintain continence or have smoother bowel movements as well.
So, are there specific symptoms that say that the pelvic floor is too tight, or is it really hard to tell just based on symptoms alone?
Oftentimes, what we see is that when the pelvic floor muscles are too tight, people do experience constipation and they do struggle to tolerate that speculum during an exam. And then penetration can become difficult, if not painful and impossible. I know a lot of cancer survivors that are in their 70s and 80s, even that really want to still be able to have penetrative intercourse, and they feel like, oh, I'm too embarrassed, or
Mhm.
maybe I am too old now. Never too old. We
Mhm.
can still fix it. And that is a really important part of being a person. So, yeah, pain with intercourse, you do not have to live with. The tissue does change, but that's where we introduce dilators, and we do pelvic floor stretching and some manual therapy and teaching you techniques so that you can go on and be with your partner.
So, if a patient is experiencing symptoms, they've accepted that there's symptoms and not normal, and they've got their referral. What's next? Like, what does rehab look like now?
Absolutely. So in pelvic health therapy, the first time we meet on your initial evaluation, we go through your medical history very extensively. In this particular setting, we do tend to spend 45 minutes to an hour at least one-on-one. That is ideal. It's important to find a practice that does that. And so what we're doing is we're going through your medical history. We're asking you questions about how your bladder is behaving, how bowel movements have been for you, and also what your specific goals are. And it's important to know every goal is important, even if you feel like, oh, if I could just be able to play tennis again, that would be enough. Like, it's all important. The fact that you are here means that whatever it is that you want to do is important. So if it is a sexual health goal, we are here to listen. We are here to help support all of those things. And then we do a physical evaluation, and that can look very different on the first day. For some people, they are going to have an internal pelvic floor muscle assessment. And for some people, that might be deferred based off of where they are in their treatment and their own comfort level. There's a lot that we can learn about your pelvic floor muscles by looking at the rest of your body and also by talking to you about your symptoms. So what that looks like is we look at your posture. We watch you bend over because your spine attaches to your pelvis, and there's a lot that we can learn based off of how you're moving. We also look at your hips, the range of motion and the strength. And then we might observe the tissue just to get a sense of what the health of the tissue is like, any effects of radiation or scar tissue after surgery. If you are feeling ready for and you're medically appropriate for that internal pelvic floor muscle assessment, what we do is we put on our gloves. We don't use a speculum. Generally, we are assessing using one finger. It goes into the vagina. We start very superficial. and then we palpate a little bit deeper. So we're just looking for signs of pain. So when we gently press on the tissue, we're asking you, does that hurt? Can you tell if I'm on the right or the left? So we're getting a sense of your sensory input and what your brain is recognizing when we're touching the tissue, because sometimes that can change as well. And then we are measuring strength, and we're measuring it in all of the ways that are important to function. So we are going to ask you to contract the pelvic floor muscles, and this is intravaginally for people that have a vagina. We would do this rectally in men, but we would ask you to contract the pelvic floor muscles, and we're measuring the strength. And then we would ask you to also contract and hold it as long as you can, and we're looking at the endurance. What endurance looks like is like if you're driving in a car and you're on the freeway and you have to go to the bathroom and the next rest stop is like 15 miles away. Can you hold it? Like, can the pelvic floor muscles support you for that length of time? Or if you're out doing something like going for a long walk, those kinds of things. And then we also look at the flexibility. So we're measuring the extensible properties of those muscles because those are equally important. And oftentimes those do change after chemotherapy and radiation and surgery. And then we use that information and we create a plan of care for you. And in physical therapy, we are treating you with the intention of getting you independent and actually discharged as quickly as possible. Not like a race, but it's also like after everything you've been through, appointments are probably the last thing that you want to be doing to spend your time. So we want to respect that and we want to empower you and get you feeling better. Because sometimes people will ask, like, how long is this going to take? Those changes do take time. It can be a process. It can take sometimes 6 months, but eventually you are going to reach those goals. So we might see you once a week for a few weeks while we're teaching you new concepts and new exercises and doing a little bit of manual therapy. And then we might slide back to every other week. And then we might go once a month for check-ins. It depends on how profound the effects of your treatment were in terms of how quickly you reach your goals. But I would say on average, for most people that are cancer survivors, it's roughly 3 to 6 months.
And I know I've heard in urology, biofeedback is used at times. So how does that kind of play into the picture?
Some clinics use biofeedback. What that looks like is we can use little external electrodes that look like little stickers or an internal electrode that looks kind of like a metal tampon or a probe, and it can be placed rectally or vaginally. And it produces anything from a very basic visual output to a very fancy output. So for on the basic ones, we have a little machine and it shows a line. And when you contract your pelvic floor muscles, the line goes up and you can see it. And it gives your brain that feedback and that information that you contracted your pelvic floor and now you've relaxed them. The fancier software packs are very fun. For example, the electrode, when you contract your pelvic floor muscles, it might show a flower coming into a bud. And then when you relax, it blooms out like a rose. Or we do see children in some cases, and we would use those external electrodes on children. But when they contract, it makes a little dolphin jump. And there's all kinds of cute little visual outputs that there can be. But not all clinics use that. It can be a helpful tool. Another helpful tool that provides visual feedback is real-time ultrasound. That is actually my preferred method of visual feedback. It's really profound. So we would just use our ultrasound head into the abdomen. We would visualize the bladder and the pelvic floor, and it's really sometimes groundbreaking for the patient because they're seeing their organs for the first time, and they're seeing, like, if they laugh, they can see their pelvic floor jump. And when they contract, they can see their actual pelvic floor contract around their bladder and lift up. And it's a very wonderful tool to do. So different tricks for different clinic types.
And do you find that patients' insurance typically covers biofeedback or the pelvic floor therapy sessions?
Yes. So especially in like a hospital-based outpatient center, those types of facilities tend to accept every insurance under the sun for pelvic therapy. Some private, smaller practices may be limited in the types of insurances they accept, and in some cases, they are cash pay. So you will see all of those different types of services available. You can find high quality, amazing therapists in a hospital-based outpatient system. I did that for 10 years. And you can also find great therapists in that private setting as well.
And for individuals who are, having issues with sexual intercourse or erectile dysfunction, what can they tend to expect as they go through treatment?
Sure. On the vaginal side, generally we are recommending dilators. I know some people are listening on the pod, but if you're watching also, dilators are cylinder tools here. These are ours from Intimate Rose. They start as small as my pinky and they gradually get longer and wider. These are intended to train the tissue to improve in length and width after the effects of radiation. A lot of radiation oncologists are having the dilators placed during radiation now, which is really helping to preserve the patency of the vagina, which is really, really helpful. If that's not part of your treatment, there's usually a great reason why, and sometimes it has to do with how they're visualizing your organs, and they want to make sure that the radiation is hitting properly. But needless to say, either the dilator is introduced during radiation itself while it's actually happening or soon after. And we're working with the tissue. It's not about stretching in a painful way. And in fact, I always tell people it should be a 2 to a 4 out of 10 or less. But it's just about gently mobilizing it and also training your brain that something coming in is not a threat, because sometimes also we have this guarding effect of our muscles to protect us after treatment or after a really stressful diagnosis like cancer. And we are training the brain as much as we are the tissue. So we're training that, and then we are educating in vaginal moisturizers, the use of lubricants, working with our medical team to see if they are a candidate for a local estrogen, which some patients that have had cancer are still a candidate for. But regardless of if it's going to be a estrogen cream or a non-estrogen cream, really educating people in using it, just like hand lotion. When your hands are really chapped, we want to make sure that tissue is nice and well lubricated. Um, and then also working on re-strengthening the muscles around that to better support it. A lot of times people forget about the importance in the core musculature as well. So we work with that. For men, after say prostatectomy or maybe after radiation because of anal cancer or colorectal cancer, we assess the tissue, assess the pelvic floor via the rectum. I know it sounds terrible, but I promise it's quick. We get our evaluation done and then we'll tell you some fishing jokes. But we just let you move on with your day, and we give pelvic floor muscle exercises to re-strengthen if the pelvic floor muscles are found to be weak. In some cases, there can be scar tissue, especially after prostatectomy, because it's not just the prostate that was removed. We have arms that come into the abdomen. Usually a machine called a Da Vinci is used. And so there's laparoscopic little arms that go in through the belly. So we do a lot of manual therapy to soften that scar tissue as well, because it can interfere with the pelvic floor muscle function. And then we often do recommend a penis pump to help restore blood flow to the tissue and make sure that it's getting movement. Oftentimes we'll couple that with, say, taking a shower or something, trying to make it as easy as possible. We're going to support them and remind them of the importance of taking their medications, and then also give hip and core muscle strengthening as well.
So tell us about your company, Intimate Rose, and what led you to start this.
Intimate Rose is my company where I create tools to empower patients for home care. So the dilators are one example. We have wands that are often used after surgery as well to help patients with pelvic pain, vaginal weights, and then also anal dilators for patients that may have experienced radiation to the anal tissue or surgery, if they experienced anal cancer or colorectal cancer affecting the outlet there. But my goal and intention as a pelvic health provider was to make tools that were safe and comfortable and easy for patients to use. So all of our tools are FDA compliant all the way across, which is no easy feat. They use a unique finish, so they're very soft, and they are also really cheerful and bright colors, because I didn't want it to look medical or stigmatized. I just wanted them to look really cheerful. But the goal is, as a pelvic health therapist, I would give exercises and do manual therapy, and then the patient would go home, and oftentimes during that gap of time, they would have a flare-up of pain, if pain was a diagnosis, or with pelvic floor muscle strengthening, they weren't sure if they were doing their exercises right once they got out of the clinic, because they couldn't remember quite how to activate the muscles. So with all of the tools, they can be sure that they're doing it right, and it's a way of bridging that clinical care to home so that they can be become more independent faster. And I think that it has been a really amazing thing to see all of the letters that come in about people getting back to having intercourse and getting back to playing golf and doing the fun things in life that they really missed. And, ultimately not being in appointments all the time.
So are there any specific concerns that patients should be aware of when using a dilator after treatment, especially like radiation or surgery type situations?
Absolutely. Number one is to use plenty of lubricant. And when I mean plenty, I mean at least a tablespoon on the tool and a tablespoon on you. Oftentimes, what I'll recommend is using a little suspension syringe like you would use to give a baby Tylenol. You can buy them at the pharmacy or on Amazon. Load that with lubricant and then press that up, and it'll coat the walls of the vagina. We just want to make sure that tissue is really moist, so that it's sliding and gliding as it's coming in and not tugging on that tissue, and also being really gentle. One of the principles that I teach with all of the tools is tomato touch. So when you think about if you're checking a tomato for ripeness to make a salad or make salsa, you're going to give it a little squish. You're not going to smash your tomato and ruin it. And that's the same amount of pressure that you're going to use with a dilator or a wand. You're going to just use that little bit of input there, and that's plenty. Sometimes people think, oh, no pain, no gain, or if a little bit is good, a lot is better. But it doesn't really take much to that tissue to get it to move better. And that's ultimately our goal.
Well, I'm sure you have a ton of patient stories that you could share with us, but can we just wrap up with one? Like what one person maybe kind of went through and experienced under your care?
Yes, it was a breast cancer patient, which when we're talking about cancer, oftentimes with the pelvic floor, we are speaking to the tissue that has been treated, like a gynecological cancer or a prostate cancer. But breast cancer patients get a lot of chemical treatment and chemical therapy, chemotherapy that is changing the vaginal tissue and changing the nature of the pelvic floor as well. And they don't necessarily receive that education prior because everything is so focused on the breast tissue and the task at hand, which I understand entirely. But then it feels like the rug got pulled out from under them on the outside of it. And so I had a patient came in and she said, I just fought for my life, and now I'm about to lose the love of my life because her marriage was really suffering as a byproduct of the loss of intimacy. And, relationships are so complex, whether it's a long-standing marriage of decades or it's a newer relationship. There's so many different dynamics to it, but intimacy is the way that a lot of couples connect. And when that is lost, they don't necessarily have the communication skills in place yet. And the hope is certainly that they are going to see a counselor and get that help. But the unraveling of that because of loss of intimacy can be so profound and it can break apart relationships. So she had come in for pain with intimacy. And we worked her through with dilators and manual therapy and exercises. And she got to the point where she could be intimate again. That one, I believe, took roughly 3 months, which that's a very good outcome. It wouldn't be shocking after radiation and some of the chemotherapy processes to have taken a lot longer. Again, she was breast cancer, so it was more some of the effects of the chemotherapy on the estrogen suppression side for her. So she did really power through and she was working so hard. But she was just so thankful for the treatment and for the dilators. And that one has stuck with me for so long. Just the phrasing, I fought for my life and now I'm going to lose the love of my life. And it hits hard.
Well, thank you for sharing that story. It really is so powerful. And again, appreciate you taking time out of your schedule to talk with us. I know this is a difficult, sensitive conversation. Really appreciate you giving survivors the language and the tools so that they can really enjoy their health and really flourish beyond cancer. So thank you so much for what you do.
Thank you so much for what you do. I appreciate you providing the platform to talk about it.
And listeners, we hope today's session resonated with you. Pelvic health is connected to confidence, comfort, intimacy, and of course, our quality of life. And you deserve support in all of those areas. If you'd like to learn more, please visit our website at fucancer.health. We have a ton of great content curated by experts such as Dr. Olson, so we'd love for you to join today. Until next time, I'm Christina Rollins. Thanks so much for listening.